Vision is one of the 5 essential human senses. But we tend to ignore our eyes' health unless we visibly see indications of irritation such as redness. Temporary redness due to lack of sleep, prolonged screen exposure, tiredness, or after crying can resolve with time. But if redness is accompanied by irritation, itching, and pus, you could have what's commonly known as pink eye. This condition affects around 6 million people every year in the United States. In today's video, we'll discuss everything you need to know about pink eye. How do you get it in the first place? Is it contagious? How is it treated? We'll be discussing all of that and more, so let's get started. Have you ever heard of conjunctivitis? We're taking you back to biology class, but don't worry if you didn't pay attention then, we have your back right now. The conjunctiva is the thin, transparent layer covering the white part of your eyes and the underside of your eyelids. This layer's primary purpose is to keep the eyeballs moist. It also protects your eyes from dust and dirt. Doctors call this layer sclera. When this layer gets inflamed, the blood vessels become more prominent, giving your eye a pink appearance. Conjunctivitis is simply the inflammation of the conjunctiva. It usually lasts from 1 to 4 weeks, or even longer in some cases. Conjunctivitis is often confused with another ocular condition called a stye. Most stye symptoms are similar to that of pink eye, except during a stye, you develop painful bumps on the eyelids. While a stye occurs due to the infection in the oil glands of your eyelids, the pink eye could have multiple other causes. The most common is viral conjunctivitis. Conjunctivitis affects males and females, kids and adults equally. Viral conjunctivitis usually spreads from schools, crowded offices, and mass gatherings. You'll be amused to find that the same viruses that cause a runny nose or sore throat are responsible for pink eye, so it's pretty easy to catch. The most deadly virus that the world recently experienced, coronavirus, is also closely related to conjunctivitis. Some scientists also believe pink eye to be an exclusive early symptom of COVID-19. The next cause is bacterial conjunctivitis. Common bacteria like Staphylococcus aureus, Haemophilus influenza, and Streptococcus pneumonia are notorious for giving pink eye. These microbes can turn eye discharge yellow or greenish. They can even make it sticky. So when you wake up and try to open your eyes in the morning, you might feel like your eyelids are stuck together. Bacterial conjunctivitis can affect one or both eyes and is highly contagious. Failing to treat this condition can cause severe damage. Allergies can also give you pink eye. You could still get pink eye if you're allergic to pollens, cigarette smoke, chlorine from swimming pools, or car fumes. It can be a seasonal phenomenon for a few people. Failing to change contact lenses also frequently can irritate the conjunctiva of your eyes. Additionally, harsh cosmetics like lotions, shampoos, and makeup might harm the delicate layer of your eyes. Another form of conjunctivitis can be sexually transmitted. Herpes simplex, gonorrhea, or chlamydia can transmit infections sexually. Pregnant women with these diseases can also give their newborns pink eye. The bacteria get transferred from the birth canal to the baby's eyes, causing conjunctivitis. Another reason for conjunctivitis in babies is due to blocked tear ducts. Babies frequently have blocked tear ducts. Most clogged tear ducts will resolve on their own or with minor treatment. A nasolacrimal blockage, often known as a clogged tear duct, affects 20% of newborns. Tear glands above the eyes on each side farthest away from the nose produce tears. Tears keep the eyes moist and safeguard the eyes by flushing away irritating or hazardous substances. A fully or partially blocked is dangerous and causes pink eye. Lastly, individuals with a compromised immune system can get conjunctivitis. A poor immune system increases your vulnerability to disease and infection. Consider your immune system a mighty army responsible for defending you from bacteria and viruses. However, when you have compromised immunity, your body will not be able to fend off infections and diseases. You can frequently fall prey to any illness and get pink eye. And now we're coming to the warning signs of pink eye. The Center for Disease Control and Prevention has given a few symptoms to look out for pink eye. Let's discuss those in detail. You can have a gritty feeling in your eye, redness, itching, and discharge from your eyes. A few chemical irritants enter your eye and can cause burning and rarely blurred vision. Sometimes the symptoms might affect just one eye initially, and as the infection spreads, the second eye will also be affected. Critical cases can experience sensitivity to light and swelling in the eyelids. Your body also gives off a few signs of early infection before you start seeing actual eye changes. You can have flu-like symptoms like fever, headache, body ache, difficulty swallowing, sore throat, and lethargy. How can you treat pink eye? The type of conjunctivitis usually determines the treatment for this condition. If conjunctivitis has a viral origin, then there are no particular therapies that can help. Your body's immunity is the only way to fight against pathogens. You can place a cool, moist towel on your eyes to feel at ease. In case of bacterial infections, your eye doctor can recommend antibiotic eye drops and ointments. Remember, antibiotics do not work against allergic and viral conjunctivitis. If allergies are the sole cause of your pink eye, your doctor will give you an anti-allergic eye drop to relieve the itching and swelling. If a chemical or particles of an irritating substance get stuck in your eye, rinse it with water. Artificial tears can also help to wash the sclera. Doctors put antibiotic drops in newborns' eyes immediately to prevent conjunctivitis. The doctors will also inform you to apply a warm compress to relieve swelling and irritation, and give a gentle warm massage for blocked tear ducts in babies. Although this condition is self-limiting and typically resolves after you start feeling healthy, if your symptoms persist fast for a few days, then don't hesitate to visit your doctor. We've all heard prevention is better than the cure. It turns out to be confirmed with pink eye too. Let's see how. First, shield your mouth and nose while coughing. We've been hearing about it a lot for a couple years. It's not only polite to cover up while coughing, but doing this can arrest the transmission of germs, including influenza virus, which is highly contagious. If you're infected and cough and sneeze openly, the microscopic water droplets can infect other family members or colleagues. Next, avoid touching or rubbing your eyes. Health experts warn you to keep your hands away from your mouth and nose and from touching and rubbing your eyes when you have an infection. The virus and bacteria can enter your eyes through the conjunctiva. Infection can spread if you rub an infected eye and touch someone else. Whenever you feel the urge to rub your eyes, use a tissue. Dry eyes could be the prime reason you are feeling the urge to scratch them. Add some moisturizing drops to your eye care routine. Also, try going off contact lenses and using glasses for a while. If you have to wear lenses, remember to follow all lens hygiene instructions and do not sleep without removing them at night. Do you wash and sanitize your hands frequently? Washing hands can save you from many diseases. If you think your hands look clean, they can still have deadly germs. Remember to give your hands a good scrub for at least 20 seconds. Lather up the back of your hands under your nail areas and the space between your fingers. But when soap and water are unavailable, you can try using alcohol-based hand sanitizer. Make sure it contains at least 60% of alcohol to get rid of germs. Alcohol can also remove harmful chemicals like pesticides and heavy metals from your hands. Remember to use the eye medicine only after washing your hands with soap. Put the drops straight into your eye without touching the nozzle. Please keep it away from your eyes so the infection does not enter the bottle of eye drops. How often do you sanitize your home? Drawer handles, bathroom surfaces, doorknobs, taps, staircase railings, light switches, remote controls, and countertops are a hot spot of germs. They can be cleaned with antiseptic cleansers, disinfectant alcohol, or hydrogen peroxide. You can wear disposable gloves and discard them after cleaning. If a sick person is at your home, take extra precaution. Other general sanitary protocols include using swimming goggles in the community pool to avoid germs from entering your conjunctiva. Never share personal items like nail cutters, washcloths, and tissues. Avoid sharing eye medicines. Avoid allergic substances. If you used eye makeup or just before having pink eye, consider getting new cosmetics. Have you ever woken up in the morning with puffy under eyes or painful styes on your eyelids? There is nothing that some home remedies can't fix. Check out these 17 easy home remedies to get rid of under eye bags, or 14 easy home remedies for styes you need to know. Go ahead, click one, or better yet, watch both and learn how to get gorgeous looking eyes. Have you ever been affected by pink eye? Let us know in the comments below.